Good afternoon, everyone. This is Saro Arakelian, your clinical pharmacist. So, hormone replacement therapy no longer carries a warning label as before per FDA. So, in this video, I'm going to talk about the recent news that came out that per FDA, the hormone replacement therapies will no longer carry the box warning cautioning patients taking hormone replacement to cause breast cancer, stroke, and other conditions. So let's get into the news that just came out. Per the recent news and FDA, hormone therapies for menopause will no longer carry the box warning as they used to. They used to carry warnings about the serious risk of breast cancer, heart attack, and stroke. This is a new update pre-FDA that just came out. FDA states this is based on the outdated science and have discouraged many women from taking hormone replacement therapies before. These medications commonly prescribed are to treat menopause symptoms such as hot flashes, mood swings, difficulty sleeping, urinary tract infections, and vaginal dryness, as well as to reduce bone fractures. They replace estrogen and progesterone, which are hormones that decline during menopause in women. They come in various forms, obviously, such as pills, patches, gels, and creams in different formats. So now FDA announces that all these forms of these menopause medications, hormone replacement therapies, will no longer carry the box warning that it used to. For a while, many providers actually had similar worries and argued that black box warnings are on hormonal therapies are unnecessary and the benefits outweigh the risks. The problem is that many women get impacted by reading these black box warnings when they go home and they stop using or they don't even initiate these therapies, which doesn't help them from a hormone replacement standpoint. Um, these warnings per FDA were in response in a study in 2002, about 23 years ago, that was halted after a detected increase of breast cancer, heart attack, and stroke in women receiving these hormone therapies. However, those in that study and at that time, the formulation that was used for these hormone replacement therapies and the medications are no longer used today. So it's kind of irrelevant in this day and age for the new hormonal replacement therapies to have this black box warning. New studies completed more recently have not found the same increased risks of adverse events. There are other options as well out there for hormonal for treating menopause besides hormone replacement, which could be cognitive therapy, antidepressants, non-hormonal medications for hot flashes. Per the FDA, they might be adding a recommendation to the label of systemic hormone therapies, like forms like pills and patches that typically contain more hormones to start the treatment in women younger than 60 years and or within 10 years of the onset of menopause. So there could be new warnings or new recommendations on these boxes of hormonal replacement therapies. So again, this is the new news that came out for hormonal replacement therapies no longer to carry the black box warning that could cause breast cancer, stroke, or cardiac diseases. So for more detailed information, if you visit the FDA website, it will provide you more updates on this news update on removal of these black box warnings. Hope you enjoyed this video. As always, stay safe and take your medications.